Hey, beautiful people. How are you? It's your girl, Dr. Doris. Guys, so on this video now, I want to talk about what to do once you get an interview invite. Okay. Yay. I know that a lot of people, when they get interview invite, they get scared, they get stressed. So I just want to tell you how to handle getting an interview invite so that you increase your chances of getting job as a medical doctor in Australia. Okay, if this looks like a video you're interested in, hop in and let's talk about it, guys. Okay, so guys, now if you get an interview call, I know it's very exciting, and a lot of people might not know how to handle getting an interview call. So, I'm going to tell you what to do if you get an interview invite. Okay, number one is to take a deep breath, organize yourself. Do not feel stressed. It's not what like it's a big deal, but you don't have to be tense because tension will make you make a lot of mistakes, especially in your interview. So try to take deep breaths, do some relaxation therapy. That's the first thing. Second thing you have to do is to go into research. A lot of you do not know this, but when a hospital or a clinic calls you for an interview, the next thing you do is to go to Google and search about the clinic or the hospital. The things you need to know are their core values. Core values are very important because that will help you in answering some of these non-clinical questions like what are the core values of the practice or the hospital. Those are going to help you in answering some of those questions. Now, aside from you knowing about the core values, you also need to be a safe doctor. So whenever you go for interview, when I've spoken to some of the people that do interview, some of the HRs, they have come to explain to me that as a doctor, they want you to be safe. They are not interested in how much you know. What they want to know is that you are a safe doctor. You still need a bit of knowledge, but then the main thing is that you need to be safe. You need to be committed. You need to be ready to commit yourself to the role. Sometimes they look for a long time doctors, people that are going to stay with them for a long time. Let's say I'm going to give you a very good example. If you are applying to work as let's say that you're applying to work as an ED registrar or an ED doctor, RM or anything, and then they go ahead in the interview and ask you that what are your future goals, and then you tell them that you want to be a pathologist or a radiologist. You know that you lose your chances of getting that job, right? Because they are not gonna employ you seriously because they want people that are gonna be committed. So if you look for a role in the ED and you're being called for an interview and they ask you your future goal, tell them that you want to be an ED doctor, you want to be an ED specialist in the future. If you get called in the pediatric section, tell them that you want to be a pediatrician. Your long-term goal is to be a pediatrician and you're committed to doing the job. That is one of the ways that you can tackle the question. Okay, now when they're asking you some questions like who is your role model, what they expect to some extent is for you to tell them that somebody that is your role model is somebody that actually has the ability to be empathetic, listen empathetically, that is diplomatic in settling conflict, among staffs, workers, and somebody that can delineate tasks. That can delineate tasks to nurses, to non-clinical staffs, to other doctors, and somebody that believes in teamwork. Those are the things that they are looking for. You need to be able to know how to work in a team, know how to work with non-clinical staff. Respect is very important. Empathy is very important. Hard work is very important. Knowing when to stand in is very important. Knowing your boundaries, professional boundaries is very, very important. And as well as knowing when to stop, when to. A lot of people feel that most of the questions that they ask, you have to go a long way telling them that you do this, you do this. Sometimes even doing nothing is good. It's a very therapeutic means of addressing some of the questions. So now those are for non-clinical questions. Things like if you find your colleague doing something, what do? You first talk to your colleague, see if they listen to you. You can also talk to someone else that your colleague can listen to before you go ahead and report your colleague. So that is somebody being diplomatic and trying to resolve conflict among colleagues. Okay. Now, another thing that is very important that I think that we need to know is that if you're being as a clinical scenario, you need to learn how to be a safe doctor. The most important thing to them is that you are safe, you being very knowledgeable, very hardworking, because this is always what happens from back home, because we come from a place that is different from Australia. Let's say people that are coming from Africans like me, you, like back home, we do a lot of job as medical doctors. I mean, we do both the RMO job, the registrar job, the consultant job. You would just have one or two consultants in a whole department if you're lucky. And even you as a junior doctor, you're the ones that will be talking to all the consultants, doing all the work. That's not how it is here. Here they share tax. They believe that you should give respect to whomever respect is due to. If you have to talk to the registrar, you talk to the registrar before you implement your plan. They want you to be under somebody. They want you to be guided properly into the Australian system. Not that you just wake up and start doing, oh, okay, a patient is sick. Let's assume that you have an emergency where a patient has collapsed and they ask you, what are you going to do? Now, me from Africa, I will tell them that, oh, I will quickly commence resuscitation. I will set line. I will take blood. From my African mindset, I will tell them that I will set line, collect blood, send the blood to the lab, request investigations, and I will get the result. Then I'll call my consultant. But that's not what they want, because I mean, you're doing those things on your own. So you should start with something like, oh, okay, if somebody is brought in unconscious, the first thing you do is, while assessing the patient, you call for help. Call for help with the nurse. Call your nurse. You have a nurse there. Call the nurse. Then you can tell the nurse to be preparing fluid. Let's say if you're assessing and the patient needs oxygen, the nurse can help you to get oxygen, help you make calls. You can even tell the nurse to help you call in the people that will set up the mechanical ventilator, or even to quickly bring in the oxygen. The nurse can place the person on oxygen while you're assessing the patient again. The nurse can also help you check the vitals of the patient while you are calling your ED registrar or your senior colleague to address them about the situation. Okay, so while doing that, making that calls, calling your colleague, you can also be calling the ICU registrar. You can be assessing your patient, setting line, stabilizing, why calling. Okay, so in the process of the call, somebody must come to you, because that is an emergency. And then when the person comes and you've already taken blood and you requested for investigation, you discuss what you've done and ask them if there's any more investigation they want you to add, so that you don't miss anything. And when you go ahead and add that, you ask them, is there any medication that you would like to give to the patient? And after that, if possibility of sending the patient to the ICU is there, you call the ICU registrar, make arrangement for transport. So that is the thing about that particular issue. So those are the things you need to know. So being safe and working in a multidisciplinary team requires an action. You don't need to cram it, you don't need to memorize it. You just need to know that if you're working in a hospital setting, even in a GP practice, you need multidisciplinary approach. Because let's say you are in a GP practice, okay, and you're working, maybe you have your supervisor, you have another doctor with you, and you have the nurses, you have the non-clinical staff. If a patient comes in and collapses in your practice, what do? The non-clinical staffs, like the receptionists, are very important. They can help you to call the hospital where you want to transport to. They can help you arrange transport while you are assessing the patient. The nurse can help you to be checking vitals while you are calling up the senior colleague or any other registrar you want to talk to make plans on how to stabilize the patient before transport. Okay, so that is what they want to know, that you can work in a multidisciplinary team. So this is what working in multidisciplinary team means. It's not about you saying, oh, I have had something where you need to explain to them how you did it with an example. And that happens in addressing your selection criteria. A lot of people just have seen some doctors writing, oh, I was able to do this. You're doing all the work. That's not what they want. They want you to tell them that you have been able to work in teams where you referred patients appropriately, you worked with the nurses, the non clinical staffs. If it is the surgery patient, you worked with the theater staffs, and everybody was working for common goods until the patient was okay. Okay, so that is what it means to be safe. And also, safety is calling your senior colleagues, talking about what you want to do, and them adding whatever, adding something else to whatever you are planning, modifying or editing your plan. There is always a room for that. That is you being a safe doctor. And there is something that is called a safety netting. Some of you might have get this question. What is called a safety netting? Some of you might have gotten this question in your interview. Safety netting means being safe. So when a patient have come to you and your patient is feeling that she is sick, or that her child is sick. Let's say a mother that is worried brought a child to you in the hospital, and you are the doctor on call, and probably the registrar was busy doing something else, and the patient is bringing the child to you. You've assessed the child and there is nothing, you don't see anything wrong with the child, but the mother is still worried. Okay, so what you're going to do is what we call a safety netting. Safety netting allows you to explain to the mother that, oh, okay, look, I am happy to let you go, and you can either come back if you notice some signs. Give the mom red flags. What is she supposed to look out for? Okay, if the mother is saying that my child is having a belly pain or all those kind of things, so you tell the mother that look out for when there is reduced urination, when the child refuses to eat, if she's having excessive vomiting, excessive bowel movement, especially if you see that her stool is kind of mixed with blood, or if you notice any sudden lethargy, any sudden irritability, any sudden confusion or loss of consciousness, please bring the child back. That is what is called safety netting. If you get more worried about the child, please bring the child back, so that we can also have a look. So you have safety netted that patient. That is what is called being a safe doctor. Okay. And look, see, if your registrar is busy, you need to just take note of what has happened and be willing to discuss it. Have a very good record keeping of what has happened, and then be ready to discuss that and hand over to your registrar whenever he comes up. But most importantly, reassure the patient and safety net the patient. If the patient is still worried and they're still feeling that they don't need to go, if the patient is still worried and they are feeling that they still need to get a second opinion, you can call in another senior doctor. Let's say the consultant. You can ask him if he has time to come and reassure the patient, and that would help a lot. And most importantly, still remember to give your patient red flags and when to come back. When to come back is very important aspect of practicing as a medical doctor in Australia. So you need to know that. So those are the major things. And then they would ask you some questions like, tell me more about yourself. Okay, tell me more about yourself encompasses a whole lot of things. It's not about you saying how many years you are, but it's just doing a brief introduction about yourself, about how long you've worked in different settings, the experience that you've been able to get, if you're looking to work in a particular department, let's say pediatrics or let's say obstetrics, you should be able to tell them that you have stayed. How long have you worked? How many years experience you have in obs and gynae? Say you have 2 years experience in obs and gynae. Okay, you can let's say that you're a doctor and you have 8 years experience, and then in that 8 years you have worked for 2 years in obs and gynae. You can just start, for instance, oh, my name is Dr. Doris. I studied. Okay, let me do myself thinking I have a 10 years experience. Okay, my name is Dr. Doris, and I studied in Philippines. I graduated in 2006, and I started working as a medical doctor. I have a total about 10 years experience working as a medical doctor, but in that 10 years I have spent 2 years in obs and gynae. During my years in obs and gynae, I have garnered relevant experiences the basic diagnostic criteria of some gynecological cases. I've garnered some cases like gynecological emergencies. I have been able to get skills on how to handle those cases, and I've also observed gently how my senior colleagues address these cases, how they talk to the patient, how they reassure the patient. I was able to carry all this knowledge along with me from this department. I have also learned some hands-on skills, like if you have skills in delivery, delivering of babies, different maneuver to deliver different difficulty delivery, cesarean sections, episiotomy, episiography, dilatation and curettage, evacuation, anything that you have learned in obs and gynae, you can state it out and you can say that. And even though I have learned all this, I have also gained both theoretical knowledge on how to handle and the proper management of different gynecological cases. Okay, and even though I've gained this knowledge, I am still willing to learn, because I believe that knowledge, like, we learn every day. So I am open to learning new things while working together to expand my knowledge, broaden my horizon, working in a team that helps me to grow, something like that. You have to be eloquent, and you don't have to be afraid. Just say what you think. There is no wrong answer in an interview. The only thing is just the way you say it and the reason why you say it. I mean, that's what makes you stand out. That's what I've come to understand by working in Australia, So yeah, that is it about that. So you talk about yourself, talk about the experience in that field, and talk about your future goals. If they haven't asked you, say in the future, look, I'm looking to become a specialist in obs and gynae. I want to be a consultant gynecologist, and that is why I have applied for this position, because I believe that your hospital will help me. So you state, because I believe that your hospital is going to help me to achieve that dream. So that is how to do it in your interview. Okay, now that is how to quickly introduce yourself, stating your future goals. You can also add your strengths and weaknesses. You can talk about your strengths and your weaknesses. I mean, your strength could be that you are empathetic, and you are hardworking, and you respect boundaries. Those are strengths. And you are safe. I mean, being able to do well in teamwork is a strength. Your weakness can be like you have a weakness with public speaking, but what are you doing to improve your weakness? Okay, let's say I have been able to register for lots of seminars. I volunteer to teach medical students. Those are the ways that you work on your weaknesses, and those are very good things to say in your interview. Okay, so now let's go to the aspect the aspect of them telling you that what are your hands-on skills. You can just list all the skills, or tell them that even though you know all these ones, you're still willing to learn more. You're open to learning. You're open to understand how the Australian system works. Okay, I mean, I hope I've been able to inform you guys today. If you have more things to say about how the right way to tackle interview questions in Australia, feel free to drop your opinions on the comment section and we can talk about it. I mean, if you've had a different experience, go ahead and talk to me and we can also talk about it and other people can learn from it. So guys, remember to give this video a thumbs up, like and subscribe to my YouTube channel, and I will see you in my next video. Bye.